Us today. Thank you for your time. Before we get started, could you each share a little bit about yourselves?
Sure. My name is George Ruiz. I'm the Chief of Cardiology here at Union, Good Samaritan, and Harbor Hospitals. I'm a heart failure cardiologist, which means I take care of a lot of patients that have hearts that aren't working so well. And that's why I'm really excited about today's topic, because it really is about how we can partner together to help people's hearts work better.
And I am Malek Cheikh. I'm an endocrinologist between Good Samaritan Hospital and Union Memorial Hospital. I'm also very excited to be here because I feel that this topic is very important and has been not talked about enough. The partnership between the cardiologist and endocrinologist is very important to help prevent cardiovascular disease in the population who have diabetes. So I'm very excited.
Thank you. Thank you both.
Got it.
Now let's dive into some of our questions. First one, what exactly is cardiometabolic disease and what does it mean?
So it's a cluster of disorders that can cause some dysregulation of the metabolic system in the body. The outcome typically is cardiovascular in nature, where patients unfortunately may end up having a stroke or a heart attack or heart failure. It originates from the metabolic system. So somebody would have diabetes or blood pressure issue or cholesterol problem that over time, if it's not well controlled, can cause damage to the organs and end up with having a heart issue.
And see, from my perspective, if you look at even the way we're seated, Malek takes care of a lot of patients that have diabetes, high cholesterol. I take care of a lot of those patients, sadly, after they've had a cardiovascular event. And so when we started to look into this further, it's really clear that what happens to people's hearts that I take care of really starts for many patients years before with the conditions that Malek takes care of. And so we started, when he and I in particular started to talk about this, we realized that there's a natural synergy, that if we can take care of the metabolic issues, diabetes, high cholesterol, and then when they work together and conspire to lead to high blood pressure, obesity, all these things together can create the environment where the heart disease actually flourishes. And that's why we're trying to figure out how folks that are on the endocrine metabolic side can partner with folks who are on the cardiovascular side to try to reduce that risk for patients long term.
That's very good. To be proactive and
that's right.
Be one step ahead.
So even for us, the problem for most of the patients have maybe started a couple of years before they start seeing us. And what happens typically for those patients, unfortunately, is that they typically start with something chronic and very common, such as being a little bit overweight or obese. And for me, from my end, the obesity is the origin of all evils, where those patients, when they start to have to become a little bit overweight, that creates a lot of metabolic dysregulation. So the fat starts to accumulate in the belly area. That can cause a lot of inflammation markers to be secreted from there that start to circulate, can cause diabetes, can cause hypertension, can cause the lining of those small blood vessels to start to get angry at us. And at the end of if that continued to happen for a couple of years, then I'm going to need to ask my good friend here to start taking care of these patients, because oftentimes they end up having heart attacks or strokes or heart failure, a thing that he definitely knows way more about than myself, and that's where the collaboration starts to happen. So if we were able to identify these issues, start to work on them at early stages, maybe we'll be able to prevent them from happening later on.
See, for a lot of the patients that we care for, what they come in with, chest pain, heart attack, or they come in with volume overload and heart failure, that is sadly the end result for many of our patients of several years of chronic metabolic challenges that have sort of pinnacled with a cardiovascular event. And sadly, when a lot of Malek's patients end up seeing me, we are starting to think of this more as a failure of healthcare. How can we preemptively go after these things? When I see patients that have that constellation of findings, when they have obesity, hypertension, diabetes, high cholesterol, and God forbid smoking, if they're smoking on top of that adds to the inflammation. The way I describe it to them is that really you have a gang of conditions in your body that are literally trying to kill you. And sometimes obesity is the glue that holds that gang together. And we find that when we go after the being overweight, the obesity, then so many things that Malek and I take care of improve. Managing the diabetes is easier. Their lipids, their cholesterol is easier. The blood pressure naturally tends to decrease. And as the weight goes down, other issues such as sleep apnea, which can also be a driver of high blood pressure, tends to get better. So we are trying to figure out what is the glue that is holding together all these conditions, try to dissolve the glue so that we can then reduce the risk of people ending up with an irreversible cardiac issue.
So I really like when you said it's like a gang that's attacking, unfortunately, our patients. I don't know about you, but I'm no superhero and I cannot do it myself. So it's to kind of defeat a gang, you're going to need a couple of smart, well-prepared specialists to be able to join forces to defeat the gang. So from our end as in endocrine, we kind of care about the metabolic part, which include the diabetes, the pre-diabetes, the obesity, somewhat the cholesterol and the hypertension, and also we kind of recently in the last couple of years we were so lucky to have multiple medical treatments that not only treat those chronic medical conditions that I treat my patients with, but also shown efficacy in decreasing the bad outcomes that we're talking about from the cardiovascular system. So that's where most of the medical societies in the United States has been advising us to do by trying to have this multidisciplinary approach for this very complicated issue.
And so from my perspective, when I see that gang start to cause problems, it falls into two main camps. The first is that gang is horribly difficult on blood vessels, particularly arteries. Arteries are the blood vessels that supply blood that's very needed to all the organs of the body. If you have these risk factors, high blood pressure, diabetes, cholesterol, and on top of that, if you smoke, that gang can really damage the inner lining of blood vessels, leading to cholesterol buildup inside the blood vessels. This cholesterol buildup we call plaque. The plaque sometimes can lead to sudden ruptures in these plaques, which can lead to heart attacks, or over time can actually make the blood vessels very stiff and difficult to fill. The other thing that the gang can sometimes do is have a direct effect on the heart muscle, and then the heart muscle can itself over time become thickened, scarred, and difficult to work. And so in both cases, it can leave the patient with serious complications. In the first, as blood vessels become more blocked up, it can increase the risk of heart attack, stroke, both of which we sadly have seen in many of the patients we care for, and are the things we're trying to avoid. And then if the heart muscle becomes stiff and unforgiving, it means that the heart has to fill at a higher pressure, which often is felt by the lungs. And then that means that patients come in with heart failure or shortness of breath. Interestingly, going back to what Dr. Cheikh said, what Malek said, if we look at the inflammation in patients' bodies that have this, their inflammation levels are very high. And so how do we turn the inflammation off? How do we pour water on that fire? And that's where we realize that we're both looking at the same problem from different points of view. If we could work together, that we can actually reduce the risk and turn the fire off. And really, that's what we're trying to do. And turning the fire off to us means controlling the diabetes, getting the blood pressure under better control, trying to get people back to a closer, more ideal body weight, getting them exercising, getting them back to the things that really mean healthy living.
Yeah, this is all very interesting. If you're just tuning in, we're joined by Dr. George Ruiz, cardiologist, and endocrinologist Dr. Malek Cheikh here at MedStar Union Memorial Hospital. Today we're going to talk more about cardiometabolic disease or disorders. So if you're interested, if you haven't heard about this disorder before, keep watching, share this with your family and friends, and feel free to ask us questions in the comment section. So considering the prevalence of things like obesity or high blood pressure and hypertension, how common that is, how common is cardiometabolic disease or these disorders?
So that's really a very important question. So from my end, I see mostly patients who have type 2 diabetes. So the teaching for years was the minute that you diagnose somebody with having type 2 diabetes, they are about or they already have a heart problem that needs to be addressed. So it's only natural that we collaborate to kind of fight this very complicated issue together. Now, almost 1 out of every 2 people in the United States have some form of cardiometabolic issue, whether it's going to be diabetes or hypertension or obesity or prediabetes or elevated cholesterol level. And all these things, of course, they're not going to be all the same severity, right, but almost 50% of population here would have some sort of this issue. So this how urgent this matter is that we need to figure out a treatment for.
And you know, look, for fear of turning these things into testimonials, right? You say it's probably 1 in 2, right? Mm-hmm. Well, I can tell you of the 1 in the 2 doctors, I can speak for myself that this is something that I battle with myself. So I've been overweight and I've tried to lose weight because I've started to develop what we call truncal obesity, where you have extra fat around the middle of your body. And it was interesting. I had a patient tell me a couple months ago, "Doc, you're a cardiologist. It's not good when your cardiologist is chubby." And I was like, "Oh, well, listen, I'm gonna try to get better." And actually, I've been on a weight loss plan myself because I feel like it's one of those things that touches all of us, including the people who are giving you the Facebook Live. And this is why this is something that's very personal for us. We really are trying to reduce the risk. And so I also started to check my cholesterol. My cholesterol was a little high and I had a strong family history. And I ended up on a statin, which is a medication that can reduce the cholesterol. And by reducing the cholesterol, it can also reduce the inflammation. In other words, I started to pour water on the fire. And I'm doing this because I have 3 beautiful daughters that I want to walk down the aisle someday. Mm-hmm. And I want to be in the best health possible. Exactly. So I want you to think, if you're out there wondering to yourself, well, you know, is this really about me? It could be. And that's where it's really important to have yourself evaluated. And either by an endocrinologist, cardiologist, or in our case, together.
Yeah, I mean, if we were going to confess about our medical conditions,
you don't have to.
No,
you don't. No, you don't have to. But he might. He might.
I also have a very strong family history of cardiovascular disease, and my cholesterol is very high. So I also take a statin. I feel that I'll be not honest with my patients if to not share these things with them. If it's a solution that I chose for myself, I'm definitely going to help them defeat those chronic medical conditions to prevent the natural course if we don't interfere. And it can happen to everybody. It's very common. It is extremely serious, and it needs to be addressed.
Thank you both for being so transparent and sharing your personal stories, because it does touch everyone. Me myself, I have several people in my family who have either passed away due to heart issues or have had surgeries due to heart issues, and that was their breaking point. Not taking those preventative steps really can have adverse effects on your health. So I know that behavior is, and our habits, unhealthy habits, leading to obesity, sometimes leading to type 2 diabetes, they play a central role in cardiometabolic disorders. But what about genetics? What does genetics play in this effect?
So from my end, diabetes, cholesterol, they are mostly a genetical disorder. We don't understand the exact mutation that can cause these things. However, if it runs in the family, most likely you're high risk of having similar genetic predisposition and end up having those chronic medical conditions. So in my case, many members of the family has high cholesterol levels. I can't ignore the fact that I am also not the healthiest in terms of exercise and eating very healthy.
Oh, I've seen your lunch. It's good,
man. We're all human here. I mean, we all make mistakes, but that's life. I mean, we have to be careful. We have to screen ourselves for these medical conditions, and if we have any of them, whether it is genetically predisposed or environmentally driven, we have to deal with it.
And from my point of view, the cardiovascular stuff, there is no doubt that there are genetic components to this. But oftentimes when people hear like, oh, it's genetics, then they throw their hands up. They say, well, it's nothing I can do anything about.
Right.
These were the cards I was dealt. And that, I think, would be the wrong message. A lot of the times the diseases that we see are a combination of having a genetic underpinning, which means that you may be predisposed to it, but there's also what you do, right? So, for example, in my case, I know that diabetes runs in my family. I know that high cholesterol runs in my family. And I also have to be cautious about the food choices I make and exercise. All these things are choices that you make. So I want you to feel like there are certainly parts of this that you do not control. The cards that you're dealt are probably likely out of your control. But how we play those cards really can make a big difference. And the other message that I think is really important is that doctors are changing the way we think about these diseases. So for example, and this is important, that hanging around Malek and folks like him have reshaped the way I think about it. So I'll have a patient get admitted to our hospital with heart failure who has coronary disease, and then we routinely check hemoglobin A1Cs, which Malek can talk about, which is a test where we look at how your sugar control has been over the last several months. We often will get numbers back that are very high, suggesting that the patient's sugar was really out of control in the previous months, leading to their coming in with either a heart attack or heart failure. And for us now, that is a medical emergency. I have to say, when I first came out of training, it's something that we would note. We'd say, oh, look, their sugars are broken. We'll get them to the endocrinologist at some point. But now I routinely call doctors like Malek, endocrinologists, to come and see patients when they're in the hospital to say, how do we get you on the right regimen to manage your diabetes? In other words, I am standing there and your metabolism is on fire. How do we wait to pour water on it? Or in my estimation, the answer is no. Then when I see a fire, we should start to work towards turning that fire off. And that's where the working closely with an endocrinologist, cardiologist, and endocrinologist, working closely together could really have a powerful impact on patient outcomes.
And also from my end, I learned so much from working with cardiologists. So back when I was in training, all what we cared about was get the sugar under control, try to target those numbers, and drop the hemoglobin A1C, which is the average that George was talking about, the last 3 months of sugars in the blood. So we would do this, and then we will think that we're doing a good job. But since then, we start to learn more and more that there are some medications that not only can get the sugars to be under control, but also to change the cardiovascular complications of this nasty disease. So we ended up using more of these medications. The patients became healthier for the long run, and we are not just fixing the number, we are paying attention to the patient. But unfortunately, oftentimes we have problems with patients where they had the disease for longer than, that was uncontrolled for longer duration, and ended up with having heart issues. But we're so lucky that we have Dr. Ruiz, that he's not only much better looking than me, but he's much smarter in treating conditions of the heart. So we built this collaboration in the last couple of years, and I think we've been quite successful.
For the record, we're both good looking.
Yes. I mean, it's
you can comment. Yeah, they can comment on the boxes. I'm kidding. I'm totally kidding.
Thank you both for that. So we talked about genetics. We've talked about how our behaviors can affect our health for the good or for the bad. So what are those risk factors people should look out for cardiometabolic disorders?
So the biggest one would be, of course, the history of having a metabolic disease in the family, like diabetes or hypertension and cholesterol problems, cardiovascular disease, of course. The other, as Dr. Ruiz just mentioned, unfortunately we cannot really change our genetic profile. However, the environment, because it plays a big role, lifestyle habits that we can change, such as exercise, weight loss, healthy diet, trying to be active, switching the amount of salt that we're taking in the diet and amount of sugar. All these things can have a very positive end result in outcomes on these metabolic issues that we see. Absolutely.
And from my perspective, the one that I'd add to Malek's list is smoking cessation. So if you have any of these conditions, diabetes, high cholesterol, high blood pressure, obesity, and or a combination of these, smoking incrementally turns up the volume on the risk. The risk will go through the roof if you smoke. And this is where sometimes when I sadly see patients that have lived with these diseases for many years, we routinely see patients in their late 20s, 30s, and 40s, when people are really at the prime, come in with horrible cardiovascular disease, in this inflammation, this fire throughout their blood vessels, where they really have a lot of cholesterol buildup and or their heart's severely affected. And oftentimes I see people with similar risk profiles that don't smoke, that don't have the disease. Smoking turns up the volume on all of this. So I like Malek said, a lot of this is, if you have genetic issues, that we can't necessarily change directly, but it's important for the viewers to know diabetes is something that we can treat. And nowadays, actually, we have medications, and Malek will go into it, I'm sure. We have medications now that are far more effective than we did many years ago. Number two, high blood pressure, imminently treatable. Absolutely. It's something that we can absolutely treat. Number three, high cholesterol. We now have medications to lower cholesterol, bad cholesterol, dramatically. I mean, compared to when we first started in medical school, now we have options that could dramatically lower the cholesterol. And smoking, there are things we can do. We have all sorts of targeted ways to try to get people to stop smoking. So I think the message here is that, yes, you have risks, but the risks can be modified. We can reshape what your risk profile looks like, and we think that the future really belongs to combinations of doctors working together with the goal of reducing the risk.
Absolutely. So it's very important to understand that we have a lot of tools that we can try to mitigate this risk and prevent those bad outcomes from happening. And of course, they start with the lifestyle modification, but when it becomes a little bit too hard for a patient to reach that target, we have all these wonderful tools that George was talking about. So for all these nasty diseases, for the most part, we can have them under control. However, one of the biggest issues that takes me off is that oftentimes patients may go for years without knowing that they have the disease. So I can't really emphasize enough the importance of screening for these diseases. And the easiest way to know would be if you have a history of any of these medical conditions, please go and talk to your primary care physician. If you are sitting listening to us and you look down, you saw you have a big belly and you're not pregnant, then definitely come and get your doctor to screen you for any of these medical conditions. Because obesity, again, is the original sin for all these medical conditions, and if we can screen and detect these diseases, then in most of the cases they're going to be treatable before we end up with cardio-metabolic and outcomes.
I think that segues into what was our next question of how we can lower the risk. So number one, of course, don't smoke, or at least try to stop smoking. Control your diet, your weight, get that under control. Speak to your primary care physician to see if you have a predisposition for these conditions, especially if you have a family history. Anything else? Anything else you want to add, or I think we covered it?
I think now, of course, it's going to be a little bit more in details, customizable for the medical condition that you have. But for the most part, this is a very good starting point.
Great.
And patients should know that we have lots of medications that we can use, that we can customize which ones we use depending on who you are, what conditions you have, whether you have heart failure, whether you have cardiovascular disease that's already there, whether you have kidney issues. By the way, that's something we didn't talk about, that just like the heart can be affected by this, the kidneys can be affected by this. I mean, we both see plenty of patients that end up on dialysis at a very early age because they've had some combination of these risk factors. So we can use medications in a very smart way to try to systematically reduce the risk. And you should also know that many of these medications have been proven by large clinical trials to help people live longer. I mean, that's a very important piece to this, that we're not just giving folks stuff that just to give them stuff.
Right.
These medications have been proven in large-scale trials and approved by the FDA specifically to reduce these risk profiles.
For an example, to what Dr. Ruiz was saying is that in 2008, the FDA mandated that any medication for treatment of diabetes needs to go through cardiovascular clearance to make sure that it's not harmful for the heart. And since then, we collected plenty of data starting from 2015 that we have a couple of options currently in the market. Not only they are not harmful for the heart, but they also help to decrease the cardiovascular events that a patient with diabetes may have. And that's only just an example to show how much more tools we acquired over the years from fighting this fight.
That's interesting. Speaking of medications, we touched on the beneficial effects.
Yes.
Are there any, on the flip side, any medications that we need to take note of that could make these conditions worse?
So from my end, there are some medications, however, typically they are not used unless you have a serious problem, and those medications may make the cardiometabolic health a little bit worse for patients. However, these medications would go under the category of cancer medications that the patient definitely needs. Some other medications very commonly used are glucocorticoids, which are with the prednisone that you take if you have asthma or emphysema or COPD, or if you have an allergic reaction that you may be given by your physician a few weeks course or days course to help with this asthma attack that you have. These medications may make your sugars go up, may make you gain some weight, may make you retain some salt and make your blood pressure go up. They are typically needed. However, there are very few medications out there that can make your cardiometabolic health. But the biggest advice that I give all my patients is, if your doctor prescribed you a medication, most likely there's a good reason for you to be on it. And always ask questions and read those prescriptions, the details of the medication that you're given, to make sure that it applies to you if that was a thing that you're worried about.
From my perspective, it's important for, I think, the viewers to understand that managing these risk factors is something that's very dynamic. It's not we start you on a medication and see you back in a year and wish you luck. Reducing the risk is a very active process, and it requires a cardiologist for some of these, a endocrinologist for many of these, in a very invested way. When they start you on a regimen for any one of these, be it high blood pressure or diabetes, many of these therapies can be escalated. They can ramp up either the dose or the combination of medications to reduce the risk. And we're finding now more and more that many of these medications, when used in combination, can have tremendous benefit for the patient in terms of helping them live longer. Particularly with heart failure, we are now looking at this in very great detail. And we are in a place now where many medications that have traditionally been used for patients with diabetes are now being considered as primary therapies for patients with heart failure. And this, I think, really speaks to the fact that what Malek takes care of and what I take care of are really one process. You know, you are one patient with lots of different risk factors, but the body senses it as one process. And even though we traditionally have had very different, you're an endocrinologist, you deal with hormones and a lot of metabolic processes. I'm a cardiologist, I deal with the heart. We realize that we are not mutually exclusive, that a lot of the processes that Malek deals with have a direct impact on the heart, and the heart has a direct impact on these metabolic processes. They work together. And so it's important for the viewers to know that we can craft a regimen that is specific to you, what disease you have, the stage you are in that disease, and it can involve medications. It can involve lifestyle modifications, such as exercise, after we've deemed that the heart is okay to do exercise. It can involve smoking cessation, and in patients that have significant weight, that are significantly overweight, it can even involve things like bariatric surgery, which can be life-changing.
Yep.
I mean, completely life-changing for the right patient. Now, I want all the folks that are watching to know we're not suggesting that you run out today to pursue all these things at once, but connecting with a health professional that can get you on that pathway to figuring out how to reduce the risk could really be a very powerful first step.
And I'm going to add that because this cardiometabolic disease is a continuum of medical issues, you may belong to a part of the spectrum. You are going to need to have a tailored, customizable medical plan that your one or a couple of doctors are going to need to work on to figure it out. That's why, because this disease can show itself or present in multiple different ways, that's why we're trying to collaborate to kind of figure out what is the best treatment that would apply to you, that may be different from what the second patient that we're going to see is going to have, that they're going to require some other medical treatment. So this is where a multidisciplinary approach for this medical issue has become very important, and that's where why the medical societies of the endocrine and the cardiology has been advising most of the medical programs to include this multi-specialty approach to this issue.
Thank you. Now, we did touch on risk factors, how we can take preventative measures to lower our risks, but can cardiometabolic disorders, how are they treated, and can they ever be reversed?
So from my end, for type 2 diabetes, I usually tell my patients, once you have type 2 diabetes, it's a matter of whether you're going to be controlled or uncontrolled. If you're controlled, you're as good as not having diabetes. If you're not controlled, then you're going to have to, there are some other issues that's going to start to happen in your way. Some of these medical conditions can be reversed, though. If you aggressively try to eliminate the reason for you to having diabetes or blood pressure problems by going aggressive with the lifestyle, with weight loss, that is going to take away most of the disease issue. But that's what I feel. I don't know about the cardiology part.
You know, if you have cardiovascular disease, in particular, if you've already developed cholesterol in some of the walls of the arteries, in general, it's very difficult for us to make that cholesterol disappear from the wall. But if we look at blood vessels that have cholesterol buildup, they could be actively inflamed, or the disease can become more chronic and cooled off. And that's really what we're trying to do, in particular with lowering the cholesterol levels in the blood, is to keep cholesterol buildup, in other words, these plaques, from progressing, becoming more angry, more inflamed, more extensive. So in many ways, we may not be able to reverse the existing disease, but we may be able to stabilize the existing disease and prevent progression, which in many cases, is particularly if we find it early, can be very impactful. Now, obviously, if it's, for example, a patient that's had long-standing diabetes with extensive vascular disease that may have lost a part of a leg because of infection or something else, some of that vascular disease may be very extensive already when they present. It may be difficult to reverse that, but we can certainly do our best to try to stabilize the existing disease and keep it from moving further. Regardless of what stage you're in, there is something that we can try to do to make the situation better. If we catch you early, the impact can be more profound. If we catch you later in the disease course, the impact can still be meaningful, although it may be difficult to reverse some of it. And that's why we're so excited about reaching so many people today, to bring them really what is a message of hope.
Absolutely.
I mean, it really is a hopeful message that yes, these things exist, and yes, many of us have the risk factors, including people who are giving you the Facebook Live. But the hope is that we can turn the risk around and make it reasonable. And I will say also that I've personally taken care of many patients that had significant levels of obesity that really was the gang leader, was the glue holding this together.
Yep.
And I've seen personally patients after losing significant amounts of weight where their diabetes, it's hard to say it's disappeared, but it's become incredibly easy to manage. The blood pressure's gotten better. People have become way more functional, and sleep apnea has all but disappeared. So in many ways, if, as Malek was saying, if we find the underlying issue and target it aggressively, and if that underlying issue is obesity and we find it and target aggressively, you can find that at very least the gang disbands, and you can manage each of the gang members in a much easier way.
Okay.
They may not all disappear, but they may become a lot easier to manage and pose less of a risk than they did when they were all working together to try to cause a horrible cardiovascular outcome.
Yeah, absolutely. So from a diabetes standpoint, if somebody loses around 5% of their body weight, not only we can de-escalate the aggressiveness of the treatment from, let's say, insulin that is injectable 4 times a day to maybe 1 pill or 1 injection a week. So the treatment of diabetes becomes much easier with weight loss. I don't like to call the diabetes to call it that it was cured by the weight loss, but sometimes we see it. We see that the diabetes disappears from when patients aggressively treat their underlying issue, which is in this example obesity, but they always stay at a risk of having diabetes back if they gain the weight back. That's the annoying part of the chronic medical conditions that we treat, because they're always at risk of having it back if they don't pay attention to their lifestyle. But definitely it's a message of hope.
Yeah.
We have multiple options. They have shown great results in multiple big scale research studies, and we know more about this disease than we ever did. So I'm very excited and optimistic.
Thank you both very much. I like that message of hope that you've given us,
Yes.
that there is something that we can do to make our health better.
Absolutely.
Thank you so much for your time, and thank you to you, our viewers, on social media for tuning in and asking questions. Keep the conversation going. We will reach back with Dr. Ruiz and Dr. Cheikh to answer those. If you'd like to learn more or schedule an appointment with Dr. Ruiz, call 410-554-6550.
There you go.
To schedule an appointment or learn more about Dr. Cheikh, please call 443-444-4193. We have a special presentation right after this, so stick around. Dr. George Ruiz is going to give a presentation on cardiometabolic disorders in Spanish. We'll see you right then.